Okay, so I think this is the part of the nursing process that feels most natural. And we're thinking part 4, implementation. If you're new here, hello, hi, welcome. My name is Judith and I'm doing an ADPIE series to help you ace fundamentals at nursing school. I love this part because implementation is where you actually do the care. This is you bedside. But there is a thinking layer to every single intervention that you do. And so I really want you to understand implementation, how it works as part of the care plan, and what you're using it as a nurse. Now, what is implementation? Like I said, implementation is the actual execution of your nursing care plan. You've assessed, you've diagnosed, you've planned. Now you can actually do the thing that you're saying with the hopes that the outcome will be what you're expecting. So this is when you're actually going to reposition the patient, actually administer those medications, actually go ahead and help ambulate. Now, the thing about implementation is that it's not just a one and done. Implementation is happening throughout the entire shift, right? You assess, you diagnose, you plan, you implement, you observe, you adjust, you re-implement. Now, the thing about implementation is that this is where nursing errors can occur, and I want you to pay very close attention to this framework for your own safety and for the safety of your patients. You want to verify the order. Verify, verify, verify. Do you have a valid order for what you're about to do? Is it current? Is it for this patient? Does it make clinical sense? Before you give that medication, what are their vitals? What do they look like? Do they still need it? Does it seem relevant still? Know your intervention. Do you know what you're doing and why? If you're giving a blood pressure medication, do you know what that medication is actually going to do, why you're giving it, and why it works the way it does? If you can't explain what the medication does and what you're watching for, I would press pause on implementing anything. And of course, like a good nursing student knows, you have to do your rights. Right patient, right drug, right route, right time, right documentation. These exist because consequences of not doing that are very dire. The last thing of your implementation framework is document everything. Document. If you didn't document, it didn't happen. I know you've heard that many times before. And document immediately, not a couple of hours after it happened, immediately. Now, I think that there's a part of nursing school that doesn't teach you how to prioritize when interventions exist in real life. We're talking about nursing plan, but sometimes you have to do implementations when everything feels important. And this is at the beginning of when we start thinking about how to take exams for the NCLEX. How do we prioritize when everything seems important? So I'm going to give you a quick framework for this. Life-threatening first. We know our ABCs: airway, breathing, circulation. If someone's status is changing, that comes before everything. The next thing, the time-sensitive things. Scheduled medications that have a particular window or scheduled interventions. Those happen next. Then we move into patient-stated priorities. You are taking care of a human. Their priorities matter too. Then last is your routine care. The things that absolutely need to happen, they can happen then. Now, you're not always gonna get this perfectly right, but if you can get into the rhythm of understanding these prioritizations, it'll be easier for you to take the NCLEX, but also easier for you to prioritize as a nurse. Now, I do want to take a minute on patient teaching because it is something that we implement, but I don't think we talk about it nearly enough. Patient teaching is implementation. When you have to explain a procedure to reduce a patient's anxiety, that's an implementation. When you have to teach a patient with diabetes about their insulin, that's an implementation. When you have to educate a patient about their discharge medication, that's an implementation. That's it. That's part 4 of the ADPIE series. I hope that you are enjoying these and finding these useful. If you have any questions, please leave them below. The last part of the series will be evaluation, and this is a biggie. This is the part that makes everything a loop instead of a line. I'll see you next time.